Okay, we are live. Andrew, welcome to the podcast. How are you
Thank
doing?
you. Very well, thank you.
Good. Have you been to the gym today?
Yes, been at the gym this morning, yes.
How did it go?
Yeah, went really well. Got a couple of PRs and did it in slightly quicker time than normal.
Nice.
So yeah, everything went well.
That's good. So, thank you for coming on to the podcast. I thought it would be interesting to talk about your experience this year of us working together, but also you have a couple of particular challenges that other people might not have to consider, and I think that gives you a unique story that it's worth talking about. To get started, just tell us a little bit about yourself.
Yeah, no problem. Okay, my name's Andrew. Just turned 60 this year in October, so quite old. I'm originally from Dundee in Scotland, but now live in Leeds, sunny Leeds.
It actually is sunny.
Hey, yeah, it's not a cloudy sky.
Do you know, my partner Lucy is from Leeds and we live in Durham in the northeast. And she often says, when the weather's rubbish here, oh, I bet it's nicer in Leeds. I didn't believe it was
Yeah,
actually true.
it is true because I've driven down that way and it gets hotter as you go down. You can see it on the temperature gauge.
So
So,
what do you do? Carry
yeah,
on.
more about myself. I'm married. I've got one kid. Well, he's not a kid, he's 28. And one grandson from him.
Wow.
So, I'm a grandfather now. So, my grandson's 4 years old.
What about work?
I don't work. I'm retired now. I've been retired for a year and it's absolutely fantastic. I can train when I want, eat when I want, I take the dog out when I want. Just you're free,
Yeah.
free from time.
You also seem to go on a lot of holidays.
I can go on holiday when you want, except my wife. She does work, so it's not as flexible as that for holidays. But yeah, I don't have to ask anybody to go on holiday. I just do it.
How long have you been taking your health and your physique goals seriously?
Right. I was diagnosed as type 1 diabetic when I was 22. Before that, I didn't give a flying fig about my health. When I got diagnosed, I took it very seriously. You have to eat properly. Can't eat junk food or sweets and chocolate. And I joined a gym then. And the first day I ever went to the gym, I got back in my car and I couldn't put in the club because my legs were that knackered. It was a nightmare driving home that first time. I always remember that. So I've kind of been training on and off since then in a gym. And then when I was 40, because my son was doing kickboxing, I took it up as well, along with the wife. And we did it for about 10 years. I got the black belt.
Cool.
And now my grandson's doing it, and he started when he was 3, not 40. So I've had to take it. You have to take it seriously as a diabetic. Well, you don't have to, but you can get complications in later life if you don't keep yourself fit and healthy.
So, a couple of questions. Firstly, do you still do kickboxing?
No, I'm too old for that now. Far too old for that. I gave it up at 50. I went in the ring with my son and I couldn't touch him. He was too quick. Oh, that's it. I'm giving this up now. So went back to the weight training gym then.
With the diabetes, what do you have to think about with the training and the diet that other people might not have to think about?
Well, diabetes, it's a 24-hour, 7-day-a-week thing. You have to be on top of it all the time, which is almost impossible, really. but to do the best you can. Probably the 80-20 rule applies there. I try and make it 90-10. But when before I train, I have to check my blood level, sugar levels, and if they're too low, I have to eat jelly babies. The diabetic nurse said 4 jelly babies is the ideal.
Right.
Would you believe? And if it's too high, I've got to take more insulin. And if it's bang on, I just get on with it. If it's slightly high, it's fine. When you do weight training, blood sugar goes up. If you do light cardio, like gardening or washing the car, it shoots down. And if I'm trying to do difficult DIY tasks or anything like that, that seems to shoot it down as well. So it's a bit of a nightmare, to be honest. If I didn't take insulin, I'd be dead.
Yeah. What about with the nutrition? So I guess most people listening will eat different things a lot of the time, and they don't have to think about the sugar or their blood sugar. What do you have to think about every day with what you're eating?
I have to think about carbohydrates every day. Although now I'm finding that proteins put my blood sugar up. But carbohydrates turns to sugar eventually.
Yeah.
And that's where you need insulin to counteract that or to let it happen in your body. Whereas normally a normal person would have their pancreas would do that. So I'd virtually eat the same thing all the time except for Saturday night. I'll just say, fuck it, eat what I want, have beers when I want. It's only once a week, but I still have to take into account the my blood sugar levels on that. So be very careful what you eat when you're diabetic. If somebody gave me a full fat Coke instead of a Diet Coke, that would be disastrous for my blood sugars.
So you have to be really careful with it all the time.
Yeah,
You have to be thinking about it all the time.
incredibly careful. Yeah, if you want to keep your blood sugars in line.
Yeah. With your physique, what are your goals and why is that important to you?
Well, I'm the opposite of virtually everybody on your course because I need to put weight on, but that's because I was born thin, very thin, with completely thin bones. So at the minute, using your course, I've put on 3 kilograms, and so I'm up to 66 kilograms now. And as a short-term goal, I'd like to get to 68 kilograms and then start cutting body fat. Because that 68, well, that 66 I have at the minute includes a little bit of fat as well.
Mm-hmm.
So I can see that on my stomach, but nowhere else. So I was going to see where I was at Easter and probably stick at that weight and just try to stay at that weight while losing fat, but remain at that weight with a muscle weight.
Yeah.
That's the goal. The long-term goal that I have is I have to stay fit and healthy, not just for the diabetic thing, but for when you get older. I see a lot of old people who are struggling. They've never exercised in their life, and you can tell. And they're not that much older than me. They're about 15 years older than me, and they're struggling. So yeah,
I think the older you get, the more you think about it. So I find even in the last few years, as I've got older, I think more about where I want to be when I'm 70 or 80. And you don't think about that when you're 20. You just start thinking about it as you get
well,
close.
that's it. Yeah, you're always on, always thinking about it.
And when I often see people my age as well who look like they're struggling and they're in the 40s. Can we talk about TRT?
Yes. Well, I was going to show you, I'll show the people who are listening to this exactly what it is I take, including TRT. So if you just bear with me a second,
Yep.
insulin-wise, that is called fast-acting insulin, and it comes in a pen. Looks like a pen, and you just dial it up at this end and inject it at this end. You can see it's tiny,
Yeah.
tiny needle,
Yeah.
and it's all calibrated. And then twice a day, so I have to take that every time I have food, or if my blood sugar is too high. That one, which is a pen as well, is called a long-acting, so that puts background insulin into you all day. I take that twice a day. TRT, that's the injection. Is it similar to yours, Toby?
Yeah. I use a short needle like that. Yeah.
It's a slightly longer needle on that, but it's very thin. That's the cypionate TRT there.
Yep. That's the same as mine.
That's how I used to take insulin as well. But until they brought these pens out, makes it a hell of a lot easier. You can carry them around and you can do injections on the fly. I've even injected through a t-shirt. Also with diabetes, I have to test my blood a lot with that.
Yeah.
Or I also have a disc on my arm and it Bluetooths to this thing. So at the minute, my blood sugar is 5.2, which is perfect. It's not really that accurate, which is why I need to also take actual blood and do it as well. And sometimes it disconnects itself and things like that, but I had to get this because it doesn't go onto my phone, the particular brand of, it's called Dexcom. I've got the disc on my arm, and you've probably seen people with lots of discs on their arm. That's what it's for. It usually goes to your phone. It gives you a good idea what your blood's doing. So that's all the paraphernalia, other than that's a needle in there. I just screw it onto the end of that pen and then inject. Just full of injections.
Yeah, that's a lot. I thought the TRT alone was a lot. How often do you have to get your bloods done for the diabetes?
Oh, for my diabetes, it's once a year. For the TRT, it's once every 6 months.
Yeah.
And you get a blood test kit like that sent to you. And then I have to go down to, what's it called? That place in the shops, the
Superdrug.
Superdrug. Yeah, I got a Superdrug, and they can actually take blood off you and send it off to them. But I have
Yeah.
to pay for the kit, which is about 80 quid, but it's like twice a year.
Yeah, same as me.
And also I take Clomid tablets for the TRT, and that's to keep your balls in working health. So the doctor's been playing around with that. He keeps upping that, but I have to pay for that as well. It's £35 pack, which lasts about a month or a month and a half. So it's not cheap.
Yeah,
And
it's
you have to pay
expensive.
for the actual cypionate. That's about £106 a month.
What's your experience been like with the TRT so far?
I've found it really helpful. It didn't kick in for about 6 months. And then within the last month or so, I felt the PRs were just going up and up. And it was showing on my body as well. And I think that's what's helped me to increase the weight as well. And that was maybe one of the reasons that I was so thin, is because I've had low testosterone probably my whole life. But you didn't know about it when the 80s,
Yeah,
when you were young. Not until the internet comes out and in full-fledged did you ever hear about it. And then when I joined your course and you said you were on it, that put a light bulb over my head saying, I bet that's what I got. So they did initial blood tests and they found it was very low. And now they're saying with the blood tests, it's too high, bring it down a bit. You can't win. It's a bit like being diabetic.
Yeah, I had the same experience where mine was low, not as low as you, but low, and then it was too high, so then I've been
Yeah,
bringing it down since. I
well,
think what I've discovered this year is that you think I'm gonna go on TRT and it'll kick in quickly and I'll get all of these benefits. But actually, I think you need to think as the first year as just being about getting the right dose and setting it up. What do you think?
right.
Do you agree?
Yes, I would agree entirely. But I've not been reducing mine down or anything like that until the doctor tells me.
Yeah.
See, from my initial dose of testosterone, he reduced it slightly and then upped the Clomid tablets slightly as well. And then he wants me to take a blood test, well, this in a couple of weeks' time, just to check and see how that happened. So they sent out a free finger prick test, which I'll be doing in a couple of weeks.
Cool. When did you join Mind and Matter Fitness? And what was that first couple of months like working together?
I joined, I think, in February.
Yeah.
You probably know better than I
Yeah.
do.
It was February. Yeah.
That's when I started doing the TRT stuff as well. It takes a month or two to get on the course to get to the stage where you're actually getting it. And then it takes about 6 months to kick in. Well, the experience with your course is brilliant. I've never had a structured training course before. It's just all gleaned from magazines and things like that, which are rubbish. They're just for your steroid-fueled monsters. These training courses, 6 days a week, different body part every day. So I used to go through all that and have done for years until we joined the Mind and Matter Fitness. And I never tracked food before either. So that's made a hell of a difference. Now I know I'm on 2,600 calories a day. And when I say to track again, it's virtually the same every day because I eat the same thing every day. But I still track it. And I would never have done that without the Mind and Matter Fitness. I've always gone to the gym religiously, but never seen much results other than feeling a bit healthier than if I didn't go.
What's been the best thing about it, about working together?
The best thing's structured course. At the app, I really like the training app and the flexibility with it. If there's a machine busy that I need to go onto, I just pick another exercise for the same body part and get on with it. But the actual app is really, really good for training. Very good. And then obviously the tracking, I never knew anything about it. I've learned a lot from your course, everything on the app really. It shows you all the techniques, how to do stuff. It shows you how to set up your food diet, and then you've helped tweak that as well, taking into mind that carbohydrates screw up my blood sugar, so I'm on mainly a protein diet with a bit of carbohydrates now and then, because you have to have some at some point.
Yeah.
And that's been the best thing about it, is the flexibility as well. You can play around with your food if you want, but I don't really have that luxury.
That's great to hear. And I'm glad that the flexibility has been a big part of it. I went to the gym this morning and it was my lower body day. And it happened to be the day where everybody was just taking up all the machines. And you just end up sitting around waiting for the machine you want. So that's why I tried to build in the flexibility of having alternative exercises that you can do.
Yeah, you wouldn't get that from a printed, if it was just printed down or anything like that. And you wouldn't get the flexibility. Also, just on the app, I can see exactly what I did last time I was training,
Yeah.
and I always aimed to get an extra rep out of what more than I did, or add up, put more weight on, and see how we get on with that. So yeah, I like that as well. You can see exactly what you did last time on that exact same exercise. That's a very handy feature.
Where do you want to be by this time next year?
68 kilograms, possible, with maybe 15 or 12% body fat would be the ideal. Whether it would happen, it's not set in stone.
We'll make it
But
happen.
yeah, but in a year's time, yeah, that would be, it's achievable.
Yeah.
It's only 2 kilograms more, and then drop the body fat and maintain the weight. So that's what I'm hoping for.
I think
But
to
that's
get there, we need to get the weight up probably to 69 so that when you drop the body fat off, you're at 68 with low body fat.
yeah, I'm not sure 69 will suit my frame. Got a very, very thin frame, ectomorphic to the extreme. So putting on muscles a bit of a nightmare at times.
We'd only be there for a short time so that when we diet the body fat off again, then you're at 68 kilograms and you're leaner.
Yeah, that's right.
That's the goal. What would you say to somebody who's considering taking their health more seriously, but they're struggling to start?
First thing I would say is the UK diet is horrible because the supermarkets sell horrible food that everybody eats, like Cocoa Pops or Pop Tarts and things like that. And most people just blindly eat that. And if they were taking their health seriously, they would go to the fruit and veg bit and the meat bit and just stay there instead of going around the supermarket eating all that and picking all that rubbish to eat, and then purposely cooking it and making sure it's just like single ingredients rather than the one full of chemicals and E numbers and whatever. That would help a lot in somebody's health. Then I would tell them to get somebody like yourself, or yourself preferably, and get a course set up and get an exercise course set up to suit them, and start them down the exercise route. Their health would be a lot better than what it is. I was on holiday in Benidorm this year, in fact, last October. My God, all the British people were huge. Every single one of them was huge. European people were all right. They were no problem. All the British people, and I blame the supermarkets for that.
Yeah. I think learning to cook as well, you mentioned that, but so many people just don't even know how to cook or how to put ingredients together to make a nice meal.
Yeah, that's right. Needs more education.
Yeah.
But who's going to educate them?
The schools.
Unless they purposely want to better and start getting on the internet and getting information. But even then, they're probably going to be misled
Mm.
in a lot of cases.
I've tried to teach my kids how to cook because no one taught me and I had to learn myself.
Right.
That's helped. It's been a good conversation. Thank you for coming on. Is there anything else you'd like to say or anything else you want to mention?
Yeah, with regards to diabetes, just in case anybody else thinks they may or may have it or know somebody, just a bit of the symptoms for it. The first thing is raging thirst. Your body is trying to flush all the excess sugar out of your body and it can't. And when I was first diagnosed, I used to drink cans of Coke all the time, which is doing it even worse because it is adding sugar into the body, but you don't know. So it's raging thirst and peeing every 5 minutes, obviously, because you're drinking so much. And then drastic loss of weight. Not planned weight loss, but actual drastic loss of weight. I looked like a skeleton when I went into hospital when I was diagnosed. Because you lose, I must have lost 2 or 3 stone,
Wow.
and I couldn't afford to lose any of that. I was trying weight gainers and everything, and that's the worst thing I could have ever tried. And the other thing was blurred vision, and that's the sugar behind your eyes. So if anybody has these symptoms, the best thing to do is get to a doctor. They do a simple finger prick test, and they can tell there and then if your blood sugars are high. So yeah, that's what I would add.
Thank you. Helpful advice. Thank you for coming on.
Oh, thank you for having me. I mean, not many people will have diabetes, but it is quite a low percentage, especially type 1. Type 2 is different, and then there's lots of other types as well. Pregnant women can get diabetes while they're pregnant
Yeah.
and then be okay when they're not. But type 1, you're on the injections for life. So yeah,
You've
thanks for letting me espouse on that.
No, it's good. I'll see you soon.
Okay,
Take care.
right, thank you very much. Bye.